Hi, my name is Casey Bailey. For my behavior change project, I am focusing on developing an intervention for one of my students at the school where I work. For the sake of this project, we'll call him Fergus. Fergus is a 13-year-old student diagnosed with Smith-Magenis syndrome, or SMS for short. SMS is a rare genetic disorder that affects an individual's development. SMS includes intellectual disability, delayed language skills, sleep disturbances, and behavioral problems. Individuals diagnosed with SMS can have very outgoing personalities, be very affectionate, and also exhibit maladaptive behaviors such as physical aggression, self-injurious behavior, skin picking, and an inability to control impulses. SMS has also been described as stunting an individual's emotional development to that of a typically developing 1 to 3-year-old child. Fergus was referred to my school due to his physical aggression, elopement, and overly affectionate behaviors. The intervention for the behavior project will focus on decreasing the instances of hugging behavior Fergus exhibits at the school. Hugging is defined as the act of or an attempt to wrap one or both arms around another peer or staff member's body with or without squeezing. Hugging may also include Fergus resting his head on another person's upper torso. Hugging does not include when Fergus reaches for a staff member's arm, places his arm on another staff member's arm, or gives a high five or fist bump. The hugging behavior intervention has social significance because Fergus will approach any individual known to him, personally or not, and embrace them. This behavior poses a high risk for Fergus's personal safety, and there is the potential for stranger danger and physical aggression from other people. The goal of this intervention is to increase Fergus's ability to discriminate who is an appropriate individual to hug and who is not. Baseline data will be collected on how many times a school day Fergus is engaging in the hugging behavior. Partial interval data will be utilized with intervals broken down into 30-minute segments from 8:30 a.m. to 3 o'clock p.m. Monday through Friday. The intervention will use discrimination training to teach Fergus who is an appropriate person to hug. To do so, pictures will be provided of family members, school staff, and peers, as well as random individuals from the internet, aka strangers. Staff will tell Fergus that hugging is for home and present an array of pictures to Fergus and ask him to identify a member of his family. Staff will utilize least to most prompting to aid Fergus in identifying a family member. Fergus will receive verbal praise and a token when he answers correctly independently. Data collection on the discrimination trials will record which prompt was required for Fergus to make the correct discrimination. Additionally, when Fergus attempts to hug a staff member, the staff will tell Fergus that hugging is for home, but I like high fives. If Fergus attempts to hug a peer, staff will block the hug and state, hugging is for home, but you can ask him or her if he or she would like a high five. This intervention will use an ABAB design, which will require a stable baseline, the implementation of the discrimination intervention, a return to baseline, and the reintroduction of the discrimination intervention. Our hypothesis is that as the independence in correctly identifying who is an appropriate person to hug increases, the instances of hugging at school will decrease.